So, welcome to your first therapy session. I'm happy that you made it today. Let me tell you a little bit about what's going to happen. First of all, a little bit about myself. I'm Dr. Ehsan Garajudaki. I know it's a long name. You can call me Dr. G. And I'm a clinical psychologist. So, I specialize in couples and sex therapy as well as addiction. Today, you have asked to come here to talk about some issues and problems that you're struggling with, and we will spend the next about 50 minutes to maximum about an hour to go over those. And I want to make sure that you are comfortable and understand what therapy really is. So, to begin with, I want you went through a so-called informed consent, filled out some form with your information, which is going to be helping me understanding you better and where you come from. I'm certainly available to you and willing to share more information about what I do and my experience and what issues I have helped people to work on. As you certainly know, therapy comes with a lot of stigma. People may think of therapy, and if they're going to therapy, that is something inherently wrong with them as a human being. And we don't believe so. We believe that every human being can use therapy as a tool to get to know themselves better and really grow as a human being. It's really nothing much different than any other type of a training and education and really self improvement type of a journey of growth that people would take, except that you're talking to an expert and an expert within this particular field of understanding the human mind is listening to you and would use tools and models and evidence-based practices, more or less research that has been done with millions of people to help you further. So that's really the ground basis and the basic elements of therapy. Now, what is important is also to understand that therapy is regulated by the departments, governmental departments and agencies such as Department of Human Services or Health and Human Services or Department of Healthcare Services, etc. So as such, there are certain rules and regulations that we have to share with you, and again, it was part of your informed consent. The most important one is what you really need to have in your hand, starting as far as a basic knowledge and understanding is concerned, is the concept of confidentiality, so that you know what are the limits of information that you're sharing and how much of it I can keep confidential. Now, because I'm a licensed psychologist, I am not supervised by another psychologist or by a supervisor. Therefore, you don't necessarily really have to worry that I would have to share this information with a supervisor. So the information really stops with me, and you can rest assured that um, all information, except for certain exceptions that I will share with you, remains 100% confidential. You can have a peace of mind that you can have a safe environment to discuss whatever is troubling you, whatever you're struggling with. Now, the only exceptions that exist whereby I would have to breach this confidentiality and basically, as necessary, share some of the information with other individuals for your own good. They include basically two categories. One is a category that we call self harm or harm to others. That means if you share the information with me that would indicate to me you would want to hurt yourself, harm yourself, kill yourself, and or other people, then that is something that really is a serious issue. I can't just keep that confidential. I will have to do something with that information in both safeguarding you and your life as well as those of others that may be in harm's way. The second category is more or less regarding neglect and abuse of special protected groups. And that includes children, elderly, and dependent individuals. Um, and So elderly are people above 65 years of age. Dependent individuals could be adults who, in one way or another, depend on you, whether financially or in terms of living condition, or even psychologically or mentally or emotionally, and other types of um, dynamics. And certainly children, minors, at least in the state of California, that is people below the age of 18. If there's information that they're being abused or neglected, then I would have to do something, which means that, again, involve some authorities, some people who are in charge of really helping. So this whole thing is designed, what I would like you to know, is designed to help people, not hurt people. So with that in mind, that is the concept of confidentiality. If you have any questions, I would be willing to answer any of those. And also, we have discussed the fees and the duration of sessions, and also usually it is about once a week type of interaction. At times, we may increase that to perhaps twice or three times a week based on necessity. Another aspect that we will certainly also discuss would be the possibility of medication, which means that at times people who suffer from very severe forms of mental illnesses, such as, let's say, major depression or debilitating anxiety, or some psychotic symptoms, which I can share with you what they are, then at times it is very useful to use medication, to what we call psychotropic medication, to help with some kind of a maintenance and containment of the symptoms of these issues, such as, again, wanting to harm oneself, a very debilitating level of helplessness, hopelessness, or heightened anxiety or panic that would interfere with your daily functioning and would keep you from actually functioning as a normal human being. We can discuss that. I do not prescribe those medications, and I don't make recommendations or suggestions, but we can certainly discuss the pros and cons and how they can work for you, as well as I can point you to the right resources to read more about certain medications. And then we would make the appropriate referrals to a psychiatrist, who would then discuss your symptoms and then also prescribe if needed. Now, in terms of continuing this discussion, this was the introduction. I wanted you to know about the basic elements of therapy. And from here on, I would be listening a lot more rather than talking. I would like to know about your current, present problem, what you are here for, what is bothering you that you would like to get off your chest and discuss. And then we can take it from there. What I can also share with you, that at one point of time, we will perhaps, very, very likely, kind of visit and discuss your history, your upbringing, your background, your culture, where you come from, the norms and mores and values that are important to you, and certainly other pertinent information. Maybe you would like to discuss things about your career or your work or your education, and maybe what you're going through in terms of relationships. We know that relationships are one of the most prominent sources of stress for people, whether it is family relationships, acquaintances, or especially romantic relationships. And also, as you're very well aware of, there's a lot going on about addiction in our world. You know, we hear about it many times, about sex addiction, gambling, online gaming, computer gaming, as well as drug addiction, drug and alcohol addiction. Those are very interesting aspects of human existence, and I'm here for you to discuss those, figure out what we can explore together, And so let's get started. I'm here to listen to you